Dr. Dahiya, what should I be doing to take care of my skin at home, and what are the most effective treatments for maintaining a nice complexion?
So a very important question, because there are so many products on the market. If you look at department stores and online, there are a plethora of creams and lotions out there. A lot of them don't work, so it's really important to use the right skin treatments. There are literally about 2 things that you need to do. Well, 3 things I should say. One is just avoiding excess sun exposure. I think we all know that. And then there are a couple of prescription products. Just those 2 alone really make a huge impact, especially over the long term. And I would say that it's one of the most important things in general about maintaining your healthy and youthful appearance, is just making sure your skin looks good. So incredibly important.
So if I want to know what kind of things I should do about maintaining my skin at home, are these things that I could come in and talk to you about? Or?
Absolutely. And again, I try to keep it real simple, so there are things that are easy to do and follow through with. There's one prescription product that I have patients use just 2-3 times a week. There's another prescription product that I'll have patients use just for a couple of months. And then we mix in a treatment once a year or 2 that can be done in the office. So between what you're doing at home and what we do for you, long term we can really maintain beautiful, youthful, healthy skin.
That sounds exciting to me, because I don't actually like to be very high maintenance. I want to have things that would be very easy for me to do super simply at home. So are there things that don't require many steps?
Yeah, absolutely. In fact, again, looking at what's on the market, there are a lot of products that have multiple steps, and I find that patients will buy skincare products, and next thing you know, they have a whole medicine cabinet full of products that just don't get opened or used. So I always try to keep it simple. I'd rather have you have 1 or 2 things that you're going to use that are going to be of real value and benefit, rather than just collecting skincare products. So it really can be simplified and yet really effective.
What are some of those skincare products that you recommend?
Sure. So one of them is just simply prescription grade Retin A. And again, that's the one that you only need to use 2 to 3 times a week. You don't need to use it every day. In fact, if you do, sometimes that can be too much for your skin. So finding the right balance is important. And then the other prescription product we have are actually a set of wipes that are great for any hyperpigmentation or color changes due to sun damage. And that's not something you'd have to use indefinitely. That can be used for 2 to 3 months, get some corrective changes, and then we can just go back to simpler products.
I actually was using Retin A for a while, but I think that I was using too much of it.
Yes.
Because I was on set filming outside, and I started to notice not only was my skin a little drier,
Yep.
but I feel like I got a bit of a sunburn.
Yes.
So what did I do wrong?
You nailed it on the head, just using it too much. And that's really, again, the secret to Retin A, is finding for your skin what's the right sort of dosage, and that can mean frequency. I have some patients who use it once a week, and that's just enough to stimulate their skin to produce the collagen that's going to keep their skin youthful, but not so much they're going to be dry and flaky and pink. Having said that, I do have some patients, different skin types, they can use it every day and benefit from it every day. So again, that's where it really comes down to maintaining a relationship with your physician and working together on finding what's right for you.
If you want to learn more about different things that you can do, not only can you speak with Dr. Dahiya, but check out some of the other content, and you'll be able to learn a lot more about Dr. Dahiya's opinions and his thoughts.